putting a mask on a asymptomatic person is not beneficial, obviously, if you're not infected.
Will mask mandates be making a comeback? Here is what you need to know about community masking, including why it's ineffective and why we need your help to ensure that the population is free to decide for themselves whether or not they want to wear fanatical facial decorations to ensure that your access to fresh, unrestricted oxygen is never infringed upon again. In many health sectors all across Canada, mask mandates have either just recently been lifted or have been applied indiscriminately since mid-2020. And as the mainstream media fearmongers amplify purported experts and new COVID-19 scariants, there are mumblings and musings about mandates, lockdowns, and other public health measures coming back. And now we're immediately revamping a previous campaign at nomoremasks.ca, which houses a petition that you can sign if you want to ensure that you can breathe freely and bear your unhindered nose and mouth in the wild amid the facial decoration enthusiasts, like the Ottawa Hospital, who has reinstated a mask mandate beginning on September 11th, which will apparently be in place for the duration of the respiratory virus season. Medical professionals knew all along that forced masking was useless, arbitrary, and unnecessary, and legal proceedings in the pre-pandemic pandemonium era proved it. Check out this repost from critical care physician and former interim medical officer of health for Haldimand Norfolk, Matt Strauss, denouncing the Ottawa Hospital decision. Quote, "The best scientific evidence we have does not show any benefit from this sort of face covering. That makes this a faith-based edict rather than an evidence-based recommendation," end quote. And he shares a screenshot of the largest meta-analysis of randomized controlled trials conducted by an esteemed reviewing body, the Cochrane Library, which found that there was not a clear reduction in respiratory viral infection with the use of medical/surgical masks. See, in 2015, the Ontario Nurses Association, also called the ONA, successfully argued against a policy that would have required unvaccinated nurses to wear masks during flu season if they chose not to get a flu vaccine. An arbitrator similarly ruled in 2018 to rescind a hospital's vaccinate or mask policy. After reviewing extensive expert evidence received by the hospital in question, St. Michael's Hospital, and the ONA, the arbitrator struck down the hospital's evidence and concluded that the policy is illogical and makes no sense. It's the exact opposite of being reasonable. There are a number of collateral reasons that support this conclusion. And we know the same holds true for community masking. The mandate was never based on science, evidence, or data. Rather, it was based on public opinion polling. Here's former MPP Randy Hillier sharing the rationale for the mandate in his riding in the Ontario Legislature in July of 2020, before former Health Minister Christine Elliott snaps back.
Like the COVID command table, our local health units are now embracing secrecy and behind closed-door discussions with unknown people to make masks mandatory. The letter I received last week shocked me. The letter confirming mandatory face masks states, and I quote, "A poll was conducted in Ottawa recently, and 91% of the public who responded agreed with mandatory mask use in indoor public spaces." Speaker, to the Premier, why is the Premier allowing pollsters to run our public health system and create policies for us?
But I want to assure you that any of the decisions that are being made by public health and by politicians are being made on the basis of evidence, on scientific fact, not on polling.
In a deep dive on mask efficacy, methodologist and evidence-based researcher Paul Elias Alexander compiled 170 comparative studies and articles on mask ineffectiveness and harms. The basis of those studies are that the data supporting the use of cloth or surgical masks is limited. Even when worn by non-scrubbed hospital staff in the operating room, they're nothing more than a costly and unnecessary ritual. Non-fit tested masks are leaky and thus ineffective at filtering particles that are invisible. While community masking does little to decrease the transmission of respiratory viruses, they do have side effects and potentially hazardous risks. According to this peer-reviewed study from the spring of 2021, unfavorable mask effects include central nervous system impairments, like mask-induced exhaustion syndrome. Masks affect your skin, the ears, nose, and throat, and major organs like the heart, lungs, and circulatory system. Masking has chemical, physical, and biological effects, according to statistically significant results in scientific literature. There is vast evidence to show that face masks are not only ineffective but harmful. The author of this particular article from American Thinker highlights the developmental detriment children have faced at indiscriminate mask policies and satirically makes masking about equity in the quote, "We can disable all children by physically impairing them from acquiring language skills and verbal mastery beginning at birth by masking the population," concluding that a masked population constitutes a physical impairment for children and/or students that impedes language acquisition and brain development. Face masks are psychologically harmful. In this 20 reasons why face masks are useful or immoral, it highlights adverse outcomes such as cavities, facial deformity due to mouth breathing, bacterial pneumonia, immune suppressing by causing subconscious anxiety and fear. Even Public Health Ontario, in a document that they used as evidence for population masking that was originally published in April 2020, acknowledged that there are theoretical risks of harms from public mask use, including self-contamination from improper use and facial dermatitis or discomfort, and that children may experience more discomfort from wearing a mask compared to adults. All of this is why we are calling on health authorities and politicians to never again implement unscientific and indiscriminate mask mandates. This arbitrary measure is not justified. It's clear that mandates did not work in the past and come with very harmful long-term consequences. If you agree that mask mandates are damaging and useless and you will not comply with another mandate, then sign our petition and send a form email to your provincial and/or territorial health ministers while you support our work at nomoremasks.ca. For Rebel News, I'm Tamara Ugolini. As discussions about COVID-19 mandates surface once again, show politicians and health overlords that you're done with ineffective and unscientific mandates. Sign our petition, send a form email to your provincial and/or territorial health ministers at nomoremasks.ca. That's nomoremasks.ca.